have to ask you permission to use this video for educational purpose and on internet.
Sure.
Do you remember your symptoms before the surgery?
Yes.
Tell me about it.
Low back pain, pinched nerves.
How long have you had it?
Pardon me?
How long did you have the pain?
Oh, many years.
Many years.
Yes.
So 1 to 10, do you remember how bad the pain was?
Yes.
Okay.
And
1 to 10, how bad was it?
probably 9.
9. How was walking before the surgery with the pain of 9?
It was sometimes not possible. and
Yeah,
You
yeah.
were stuck in bed.
Yeah. Now, your surgery was about a year ago.
Yes.
Before we did the surgery, it was some question what level is the pain is coming from. We did a study, we call it a discogram, where we increase the pressure inside of the disc, and then we see if we provoke it to see if that's where the pain is coming from. Do you remember that study?
I do.
It was painful, wasn't
Yes,
it?
it was.
Yeah. So, what do you remember about that study? If you would describe it to your neighbor, how would you describe that test to your neighbor?
Not a very nice one. It was painful.
Yeah. But do you remember what we did?
Yeah, I remember they did give me a sedative, so it was
Yeah,
a little bit better.
Yeah.
And
So,
they injected dye into the disc,
okay.
and then afterwards they did
Every
3
level.
of them, I think.
Yeah.
And then I went in for imaging.
Yeah. So practically, we put a tiny needle inside of a disc, like putting air in a flat tire, to see if it has 5 holes or 10 holes.
Right,
And most importantly, to see if that provokes your usual pain.
right,
We found out the bottom 2 discs were the problem, and we fixed it almost a year ago.
right.
So do you remember the surgery?
Yep.
So how long did you stay at the hospital?
I had to stay, it was the same day, but I had to stay 1 extra day.
Yeah, it usually, rarely people stay, a little longer, but many people go actually home same day. I have the record of the surgery here, and that surgery was actually in 71 minutes. We lost about 72 cc of blood, and yes, you stayed just over the night.
Right.
I have the record here.
And that was only because of oxygen in my blood was low.
Yeah, the anesthesia and the oxygen was, but many patients go home same day. So
Yeah.
this is what we did. We did a 2-level OLLIF transcambine OLLIF fusion for you, and here these are the screws, and bone, as you see here, growing in the back, but as well bone is growing here. Bone is growing in the front beautifully. So I'm very happy. Bone is growing in both areas. So, how is the pain now?
Pain is much better.
Much better?
I know when I overdo it, and if I put ice on it, it goes away right away.
Yeah, so what number would you give the pain now?
Right now, probably almost none.
None.
But I do take Advil.
Yeah. Do you remember pain in the legs? Do you have any pain in the legs?
No.
So the pain in the leg is completely gone.
Right.
That you had before the surgery.
Yeah.
Have you had pain in your legs since the surgery?
No, for a while there was,
Yeah.
but then probably 6 months after it was gone.
The pain that you had 6 months, was it in the back or in the legs?
Well, mostly the back.
Mostly the back.
Yeah.
Yeah. So the back pain took about 6 months to really go away.
Right.
And this is what this conversation is about. That sometimes it takes time for the back pain to go away. It doesn't go away right away.
That's correct.
No, but do you as well notice, or do you remember when you start having less pain in the leg, or?
I don't remember when that
Yeah.
started to go away.
Yeah. So it has been a good thing you don't remember it. You don't want
Yeah.
you to remember that.
Because the back pain
Yeah,
was so bad.
Yeah. Generally, leg pain goes away much faster than the back pain.
Yeah.
And I remember from our last conversation that right after the surgery, that the back pain obviously took 6 months to go away, but the leg pain in the 1 month and 3 months after the surgery visit, I have my medical record. That I don't remember either. That's why we write it
Yeah.
down. Start getting better pretty fast.
Right.
So, how is daily activity? How is walking?
Walking is okay.
Yeah.
I do real well at that.
Yeah.
It's still the bending and lifting. I still
Yeah.
got to be careful.
Now you remember I gave you bad news.
Yes.
What bad news did I give you?
I'm not young anymore.
Yeah. Well, I didn't make you younger.
No.
That's if I may ask how old you are?
67.
even with the surgery, you're still 67.
Yep.
And that's one of the another reason I'm taking this testimonial is I think you have a good common sense. You're automatically understand that you tell me right now. If you do more than your body can take,
Right.
your body tells you and you stop.
That's right.
And that will keep you out of trouble.
Yep.
Now, I just in the other room, I had a 85-year-old patient, who was asking me when he can go back motorcycling. And I just had to, hold back and tell him, eventually we have to stop things that are too
Yeah.
demanding.
Yep.
Now, either we learn it mentally or nature teaches how to do that.
Yeah.
But I think you are not in that category. You have a
No.
good common sense. You stay away from excessive things automatically.
Yep.
And it's not like there's an age cut to say when you can or
That's
cannot
right.
do certain things. But I think every person, your body is talking to you.
Yep.
If you listen, you're out of trouble. But if you drive a motorcycle, you're 85, you drive a motorcycle and your body aches, and you just keep doing that, that is when we get in trouble.
That's right.
Any other question or comment so
No.
far? Happy with what we have achieved?
I'm happy with what happened, the way it turned out.
Yeah, thank you very much. I really appreciate your interview.
Thank you.